think one of the most exciting things for me personally has been I was able to chair the ASH Scientific Committee on Immunology and Host Defense in the past year. And our scientific committee session yesterday featured three great speakers, Jim Allison of the University of Texas MD Anderson Cancer Center, Bruce Blazer from Minnesota, and Catherine Wu. Dr. Allison won this year's Lasker Prize in clinical medical research, and his work in checkpoint inhibitors has led to over 70,000 patients being treated with therapy to activate the immune system. And to me, the growing therapeutic potential of immunology and activation of the immune system as opposed to traditional chemotherapy approaches has been an exciting thing to witness through this meeting. In addition to, I think, the work that was presented in the session that I was chairing on checkpoint inhibition, we have had more dramatic results of chimeric antigen receptor T-cell therapies for ALL, and now other diseases, including there's some very intriguing results presented in multiple myeloma and additional results presented in B-cell lymphomas. So as an immunologist who has been thinking about the power of T-cell immunology and knowing that allogeneic or donor hematopoietic stem cell transplantation can cure malignancies, we've certainly known that for decades, to see the generalized T-cell therapies that are really part of donor transplantation now being translated to increasingly targeted antigen-specific T-cell therapies, and to see the potential for combinations of these agents between doing stem cell transplants, providing novel drugs directly targeting the growth of leukemia cells, and then using immunotherapies, either activating the immune system or actually genetically engineering T-cells to treat cancers. I think that this is a very exciting time, and we've kind of seen, to me, immunology transition from a largely theoretical notion that other than in a general sense like allogeneic transplantation that we could cure cancers, and we're now seeing just an amazing explosion. I think the 5 approvals this year of checkpoint inhibitors are a great example of, I think, what's to come, and I think in the next couple of years we're going to see the T-cell transgenic and CAR T-cell therapies get FDA approved, so we're really exploding into a golden age of immunotherapy. So for me it's been a lot about immunotherapy, but that's of course my scientific bias.